আমরা কমপ্লিট করেছি। শুরুতেই আমরা যাব এই সার্জারি যে ব্যাকগ্রাউন্ড আমাদের কন্ট্রোল ডিপার্টমেন্ট থেকে এই সার্জারিগুলো হয়েছে এবং আমাদের সার্জারিগুলো কেমন হয়েছে সেটা নিয়ে আমরা একটু জানবো। আমরা খুব ভালো করে জানি যে ক্যান্সার নিয়ে যদি একটু সংক্ষেপ করে বলা যায় সেটা হলো আমাদের নন কমিউনিকেবল যতগুলো ডিজিজ আছে তার মধ্যে ক্যান্সারটা কিন্তু অন্যতম। এই কারণে সবগুলো নন কমিউনিকেবল ডিজিজের ট্রিটমেন্ট কিন্তু একটা ডিসিপ্লিনের ডক্টর দিয়ে সম্ভব, এক্সেপ্ট অনকোলজি। ক্যান্সারের ট্রিটমেন্ট দিতে গেলে অ্যাটলিস্ট তিনটা ডিসিপ্লিন লাগে, এটা আমরা জানি, যেমন রেডিয়েশন অনকোলজি লাগে, মেডিকেল অনকোলজি লাগে, হিস্টোপ্যাথোলজি লাগে, সার্জারি লাগে। সো মূল যে জায়গাটা সার্জারি নিয়ে আমরা একটু কথা শুনবো। আমি আহ্বান করছি একদম শুরু করি PowerPoint presentation में प्रोफेसर डॉक्टर रिचर्ड काफी आलिफ सर।
Assalamu alaikum and a very good afternoon. It's a very great occasion for all of us, especially for our hospital, David Cancer Hospital, that we have successfully completed more than 1,000 plus onco-surgical cases within 1 year. I am going to present you how our surgeons and how the hospitals has contributed like this. You see that our registered patients from 2021 to 2023. Actually, our hospital has started its journey on 2021. So for the 3 years, we have total registered patients of 1,03,627, and this number is actually increased as 24 is running. And division-wise, if you see that Dhaka division is in highest 68%, more than 68% from the Dhaka division, and next is from Chattogram. We told that we already completed more than 1,000 successful onco surgeries. And I am going to tell you that the discipline wise, if you see that, first of all, the topmost is oncoplastic breast surgery. Out of 1,027, oncoplastic breast surgery operation done is 237. Oncogynae surgery 222, and next is onco head neck surgery 130, and hepatobiliary 140, and the onco general 102, and the procedure like the camo port insertion surgery. These are all of the actually onco related. 47, orthopedics 46, onco neurosurgery 46, orthoplastic surgery 29, colorectal 27, facial maxillary surgeries 21, neurosurgery 6. Percentage wise, you have seen that oncoplastic breast surgery is 23%, and the gynae onco 22%, onco head neck 13%, onco general 10%, onco euro 5%, and like these others. The incredible surgeons, the great surgeons, actually they are the very eminent surgeons of various disciplines. First of all, we must say that the gynae and oncogynae, our renowned surgeons are here, Professor Dr. Sabira Khatun Madam, Professor Dr. Shahana Parveen, Professor Dr. Janatul Firdaus, Dr. Farjana Sharbin Biti, and Dr. Sylvia Hussain. I am sure the renowned doctors who are actually regularly performing their procedures and operation here. Besides this, many surgeons are also doing. Next, the general and onco-general laparoscopic Professor Anisur Rahman Sir and the Professor Abdul Kalam Chaudhary, medical oncology Professor Dr. Sitabur Rahman, and the oncoplastic breast surgery Dr. Ali Nafisa and Dr. Nilufar Sarnam. Oncosurgery Professor Dr. Abu Hanif, Dr. M.D. Abdul Karim Mithu, and Dr. Mahmoud Hanif. Orthopedist Dr. Syed Shahidul Islam and Dr. Sirajul Salihin. Oral and maxillofacial surgeries Professor Dr. Nasiruddin. hepatobiliary, pancreatic and liver transplant surgeons Dr. Akhtar Ahmed Shubho and Dr. Anarul Islam, urology and oncology surgeon Professor Jahangir Kabir Sir and Professor Dr. Tauhid and Saiful Hussain. Plastic and oncoplastic Dr. Tanvir. This is the first time in our hospital, not only our hospital in Bangladesh, that we have successfully completed 1027 surgery with minimum surgical site infection. Our surgical site infection rate is 1.25%. In other hospital it is 3 to 8%. India it is 8.2%. UK 1% to 5% and USA 0.5 to 3%. This data is collected from the various research articles. Actually, in our hospital, the surgical site infection rate is comparable to the UK and USA like this. It is not comparable to any other hospital in Bangladesh. In our hospital, it is 2.8 days, but in other hospital of Bangladesh, it is 3.4 days. It is comparable to the international standard. It is 2.9. Is the most modern, elegant architectural design corporate hospital in Bangladesh. We have 6 modular clean operation theatre and one is the robotic operation theatre we have. All the modern technologies have introduced in this operation theatre to provide the best surgical care to the patients. All the operation theatre is modular operation theatre. You know that for the modular operation theatre, it is main contributory factor to prevent the surgical site infections. We have other factor also. This is the team operation theatres. Mainly work with the surgeons. No anesthesiologist or other staffs needs to assist surgeons to do operation in our hospital. And you know that we completed more than 1,000 operations, but no table death in our hospital. This is actually record. We did lot of complicated operation here. Normal operation and the cancer operation, you know, they're very, very different. In cancer patient is immunocompromised. Most of the patient remain immunocompromised, debilitated, lethargic, pathetic, but and with a lot of multiple comorbidities, but we don't have any debilitated. One patient died in ICU. That patient has lot of comorbidities, including that he has a cardiac problem, this ventricular, atrial fibrillation. But we took the patient for emergency, but ultimately patient died in ICU. That was the emergency patients. For guideline, suppose the pre-anesthetic assessment, 100% patients must undergo the pre-anesthetic assessment. No, we don't take any patient without assessing. It is required for the safety of the patient. All should know that before taking the patient in operation or routine, patient, what are the comorbidity? Patient, you know the comorbidity, hypertension, diabetes, other disease patient. It should be controlled or minimum the controllable state before taking a patient. We need to do some investigation also. 100% we do the pre-anesthetic assessments. And counseling is another important factor. We do pre-operative and post-operative counseling to all the patients. Counseling to the patients, patient attendants. It reassures and it calms and it gives the boldness to the patient that I am going to operate it, this and that will be done to us. And the pre-operative station, you know that when we take a patient to the operation theatre, before taking to the main OT, we keep the patient in the pre-operative station. There we reassess the patient, we give some pre-medication and prepare the patient for the next stations. During operation, we always follow the whole surgical safety checklist. It is mandatory follow. That's why so far we don't give any wrong side, wrong patient, wrong surgery. It is not possible in our hospital as we follow the whole surgical safety checklist for every patient. Just I am stopping my speech then and after recovery, post-operative patient, we also do the needful. Day after operations, not only the surgeon, our team, the OT team, anesthesia team and other also visited the patients to see the condition, and if need, we give advice and do accordingly. And the sterility management in our hospital, I have already told that as the surgical site infection rate is comparable to the international standards. This is the main, one of the important factor also, the sterility management. Standard sterilization and critical cleaning protocol we are following. We have the one standard CSD, Central Sterile Supply Departments. We use the consumable item, that is non-reusable items. You know that oxygen masks and others in many hospitals, they are using one patient to another patient, but actually we discard. It actually helps to reduce the surgical site infections and the contamination by others. Hand hygiene, we follow the World Health Organization guidelines how to hand hygiene. Some centers you may find that just their scrubbing starters and they finish. But in our setup, we follow the standard protocols of hand hygiene, scrubbing, and the personal protective equipment (PPE) and the NG restriction, biometric NG we have. And the training and quality indicator. Training is always needed for the regular improvement of the doctors and staffs. We are doing regular training to our staffs, doctors. And the quality indicator, you know that the sound quality, we are trying to get the JCI accreditation. That's why we are following the adverse drug reactions, morbidity, mortalities, we are following and doing these ones. Thank you very much for patience.